Now, if you're frustrated with the lack of clear information on the topic of Crohn's, you're not alone. Literally everyone who steps foot in my office and eventually succeeds at ridding themselves of Crohn's disease, every single one of them has these frustrations to begin with. Just a little bit of background again. I'm a surgeon specializing in disorders of the gut. I treat folks with inflammatory disorders in my practice. If you're here, chances are you deal with inflammation due to Crohn's disease, or perhaps you don't know your exact diagnosis and suspect you may have Crohn's disease or overlapping conditions. Many times you don't even know what to do about it and end up seeing a doctor, specialists who are not helpful and not getting answers, and that's not okay. But this is a common problem, and I'm here to say that armed with the right knowledge and the right guidance, my clients have successfully resolved symptoms and reversed their disease in a matter of weeks. My typical client is someone who's experiencing unusual symptoms from an inflammatory disorder such as Crohn's disease, because this inflammation affects the whole body. They may be having a combination of the following symptoms. You may be having trouble digestion one day, joint pain the next, brain fog and fatigue the following day, and the list just goes on. And they have symptoms that can include rashes, dry eye, back pain, numbness, and hair loss. Typically, even after seeing a doctor and running tests and taking medications, there's no real plan to address these issues. Some of my clients are being told that their Crohn's disease is futile and there's nothing they can do about it. You just have to deal with it. Some doctors even have a difficult time making the right diagnosis, and I'm here to tell you just the opposite, that Crohn's disease is something that can be easily mitigated and prevented with the right tools and the right knowledge. I know because I see people in my clinic get better all the time, even after they've tried other treatments, and even when they're unsure about their diagnosis. So where do we start? How do we retrain our immune systems to function for us instead of against us? Well, I'll use this opportunity to introduce the concept of mind-gut immunity. If we want to reset our immune system, we must first heal the gut. But if we want to heal the gut, then we also need to heal the mind. This is probably the most important strategy I can share with you here today, because it's the reason why so many of you may be struggling with Crohn's disease for so many years. It took me several years to finally figure this out, that we need to approach Crohn's disease as a three-part problem, and you need to target this approach to all three components, not just one. And if you can optimize all three parts, you have a pretty good chance of Crohn's disease just going away. So what are the principles we can leverage to favorably optimize the three parts of this axis? What is the most important and relevant question you can ask yourself?